My name's Phil Quinlan. I'm a Professor of Digital Engineering and Health Informatics at the University of Nottingham, and also an honorary role in NUH, where I'm the Honorary Director of Digital Health Research. For TREvolution, I'm coordinating the effort. So it's a joint leadership program, but we're coordinating it from Nottingham between the other four. TREvolution has just started on the 1st of March, was kind of our kickoff of the project as a whole. And what we want to do is bring everybody together in one place, all the different teams, members of the public, the techies, and everybody together into one place to really understand what is it we're going to do over the next 2 years. So it was kind of assembling the team, bringing them to Nottingham so we can coordinate and really learn from each other. Today is the official launch, so we've just done the presentations, we've done the live stream and everything we're trying to do, explaining the program and what we're seeking to achieve over the next couple of years. When I talk about the work we're trying to do, I talk about personas. So I have Razia, the researcher that I refer to. She has a hard time at the moment. So if she wants to do research across different TREs, she has to log into each environment, she has to do an application each time. She goes into those, she has to write code in every single one, work out how to get that code out, then to do the analysis on top. And it means research, even just between a few different TREs, can take multiple years to get done. All of that effort is on one person trying to make it happen. There's often a team as well around it, but it's so much on the research team to try and make it happen. There are technology, there's processes, and there's people that we can bring to make that easier. And so what we're trying to make it do is not transform the whole environment, but make it easier for people to do research that's required to answer some of the big questions we have in society at the moment. TREvolution has been coordinated from Nottingham, but we also have co-leadership. So we've got Dundee, Manchester, Swansea as part of that wider team. And really important, we've got University of West England in there as well, with all their experience of disclosure control and governance. And then we've got a wider team that is really helping to collaborate with us across the whole program. Universities across the country, but also NHS organisations and other organisations that have data. And then really important for us is the wider DARE program. TREvolution is part of that. We've got the adopters and we've got the community groups that we're all going to be working with together as one single program to help deliver the really important objectives for DARE. So we've got some amazing international partners. We've brought in a team from the University of Cape Town, for example. They have built a federated network across the continent of Africa. We are learning it, or we have learned and will learn so much from that partnership with them, telling us, how did you do it? Right? We want to learn, and part of that's learning what not to do as much as what to do, but they're a core part of that. We've got collaborations with the University of Basel as well with their team in Switzerland, bringing some technology over. And really what we're trying to do, yes, we're doing this from a UK perspective, but the whole power of this is when we can go international. So we've also got collaborators, University of Queensland in Australia, so that we can understand, does it work in the UK, but does it also work in other places as well? TREvolution is a program of work that's really assembled previous DARE investments now as one. So we've got SATRA, which was trying to define what is a trusted research environment, because there hasn't been a specification like that before. We've got something called SACRO, which is a project around disclosure control. So how do we make sure that when results are taken out of a trusted research environment, that those results don't contain something confidential? And then we brought in two technology components. One is how do we move the analysis around the different trusted research environments? And the other part of that is how do we create a network of trusted research environments? At the moment, they're isolated instances, so each TRE is its own entity. And what we're trying to do is build a network where we can have them all together. So a researcher, by accessing one, can access a network of them. And that's building on the Teleport project from before from University of Swansea. I see there's three main challenges that we're trying to address. One's on what is possible, what's on what is acceptable, and then also what's useful. We're focusing a lot on what's possible at the moment, so what can the technology bring? But what the adopters bring is also helping us to understand, is what we're doing acceptable? Is it something that TRE's willing to adopt? Can they install it? Is what we're proposing in line with their existing governance procedures? So we're doing a lot of development work, but they're also validating and ensuring that it works for them and it's in line with their current procedures. We've had the public here all week, so we've had key members of that team present asking really insightful questions, which has been so important for us to make sure there's a transparency of everything that we're trying to achieve. Going forward in the program, although it is a technical program, we're making sure members of the public are going to be right in the middle of all the work that we're doing. And we're going to be putting our team through a training program, for example, to make sure they understand how to use that valuable insight that comes from the public and make sure we learn from them and know how to include them in the best way. There was a brilliant report from Dare UK previously, looking at the impact of not being able to do this. And I think this is the problem. Research can obviously happen now. It does happen now, but it's limited. We've got data in different silos. They're not able to link them. They're not able to bring them together. We have governance that definitely protects and is there to make sure confidential data stays confidential. But how do we provide the environment that researchers can actually ask the questions that we all need answers to? And that's what we're trying to tackle. We still want the security, we want the confidentiality, but we also need to make sure that researchers can access the data in an easy way to enable their research and really empower them to ask questions that today they think are impossible. And we want to be able to change that in the future. We would love to see the UK being right at the centre of this internationally. We see many programs internationally going on at the moment. Everybody's tackling this issue. How do you have technology, but also maintain privacy and confidentiality of that data? We would like to see that researchers are actually able to do their research quicker and on larger scale data sets. And the larger scale data sets just makes that data more reliable and repeatable for other researchers as well. So it's changing that dynamic that we're seeking to do.